Welcome back to GB News Saturday with me, Dawn Neesom, on your TV, online and on digital radio. Now, for many people, it's a pride and joy. But for men who are losing their follicles, that's hair for you and me, it's no laughing matter. New research shows how 1 in 4 men in the UK are considering a hair transplant in 2024, with a treatment around hair loss more accessible and accepted. Joining me now to talk about this is hair transplant Dr. Gülsultan Doğan. Hello, thank you very much for joining me this afternoon. Now, this is one of those things, there's so many things that we snigger, especially women, we snigger. I tease my husband constantly about this, but it's actually no laughing matter. Mental health issues around it, so much wrapped up in masculinity and hair. So tell us a bit more about hair transplants, how they work, and are they becoming more acceptable?
Thank you. Actually, hair transplantation is becoming very popular among men recently. It is not creating hair follicles from the scratch. It is just replacing the hair follicles from the back of the head to the balding and receding parts. So it's like 6 to 8 hours procedure. And after a certain time, the men get back their hair. In Turkey, recently over 1 million people are having hair transplant from all around the world.
I'm just reading here that 70% of men experience hair loss, and remarkably, 1 in 4 see first signs of baldness before they reach the age of 21. Hello, I think Dr. Gül. Oh, I think we've lost Dr. Gül. Hopefully we'll be able to get her back. Well, let's talk about someone who's experienced this. And joining me now is Benjamin Dridge, who you've had a hair transplant.
I have, yes.
Go on, Benjamin. Tell me exactly how long ago.
Literally 9 days ago.
This is amazing, yeah. Right? And you are just, I'm not being rude, you are 30...
I'm 33.
33 years old. Yeah, hair transplant just a week ago, literally. So tell me your story. Why did you decide to have this done?
So I've been losing my hair since I was probably in my early 20s. Obviously genetic, father, my brother, both bald people, and they've embraced it. Everyone said to me, shave it off. I was just not ready to do it. I took the thing, I looked into a few things.
Wow, there's a picture of you before your
that's actually, it looks awful, but that's actually what I was like before.
Astonishing.
Obviously, I'm at the early stages. It's got a long way to go, but I'm really happy with the results.
And that's a close-up of your head we're seeing now?
After the surgery. But everyone at MCAN, MCAN in Turkey that I used, is just right from the moment we landed, I didn't have to do anything. It was all, I was driven to the clinic, driven to the hotel, totally looked after. They give me very nice Turkish cuisine for lunch, and it's just a fantastic experience, and absolutely loved it. I'm so pleased, and I feel like I'm going to get my confidence back. And
how much does it? I mean, because as I said, I tease the husband constantly about this, but it's not a laughing matter. How is it affecting your mental health?
I don't think there's people that I've known probably for 5 or 6 years that have never seen me not wear a hat. That is literally how it affected me, but people wouldn't even know that. They've never seen my head, so they wouldn't even know how it affected my mental health. But I think for men, it's not really spoken about, but it does affect, especially young men, their mental health massively, definitely.
And it's amazing just a week after your treatment. So, I mean, how long are you in the clinic, and how long does the procedure take?
So I've actually got 4,600 follicles, which has been transplanted, which is quite a lot. So my procedure actually took 11.5 hours from start to finish. Wow. But that includes stopping for lunch. But it was a very long.
And you're awake through this, are you?
It's local anaesthetic, so it's just all, I'm just all numb. But yeah, I was just sat there. I was listening to podcasts and.
And is it like Dr. Gülsultan Doğan was saying just now before we sadly lost her? They take the hair from the back of your head.
Yeah, so the donor area. Now it's an FUE. They used to take a strip of hair, so you used to have a scar. But now it's called, now they take it from multiple areas so you don't have a scar. So it's literally all around the sides. But as you see in that photo, my actual hair on the sides was quite long. It was just the middle part that was balding.
Yeah. OK, I think we can go back to the doctor now. Dr. Gülsultan, are you there? Have you come back to join us?
Yes, I'm sorry.
Hello,
I
yes.
thought we had a connection problem. Yeah.
Yeah, no, not a problem. It happens a lot, don't worry. I was just saying that sort of like 70% of men experience hair loss, and remarkably, 1 in 4 men see the first signs of this before they reach the age of 21. So Benjamin here, isn't that unusual that he was so young when he started experiencing this problem?
That's true. I mean, when the hair loss speed is very high, really, we generally advise the patient to wait for a while. After the hair speed loss is slowed down, then we invite them to a hair transplantation. So the ideal age will be based on the person. Of course, it changes, but over like 24.
And how do you decide who is suitable? I mean, do you have to have a lot of hair at the back of the head to be transplanted forward?
Yes, there are multiple factors that define if you are a good candidate for a hair transplant. The availability of the donor area, your medical conditions, as I mentioned before, the hair speed loss, all these variables affect if you are a suitable candidate, but most of them really are suitable, so we invite them to hair transplantation.
Mm-hmm. And have you seen an increase in British patients coming to you for hair transplants?
Yeah, especially after pandemic, we see a growing in the number of patients coming from UK to Turkey for hair transplantation. Our portfolio, like 48% are coming from United Kingdom.
OK, Dr. Gülsultan, thank you very much for joining us this afternoon. Absolutely fascinating.
For inviting me.
Thank you very much. Benjamin, just one final word to you. We're running out of time. What difference has it made to you?
Massively. I feel like, obviously, we're still at the early stage, but as it grows, I think as my hair grows, my confidence will grow. So.
And I have to ask the $64,000 question: is it expensive?
No, not for what it's doing to me.
Right. OK. Worth every penny.
OK. Thank you much.
Perfect. Thank you very much for joining us this afternoon. That's Benjamin Bridge, who, as you can see, has got a head of hair back. Amazing. Right. You're watching GB News with me, Dawn Neesom, on